In today's rapid update video, we'll be going over a guideline side-by-side for ulcerative colitis, also known as UC. Ulcerative colitis is the most common type of inflammatory bowel disease and is characterized by inflammation and ulceration of the colon. This guideline side-by-side will compare the latest clinical practice guidelines from the American Gastroenterology Association, also known as AGA, and the American College of Gastroenterology, known as the ACG, on ulcerative colitis, focusing on pharmacologic treatment of moderate to severe UC. The recommendations made are meant to guide clinical practice, taking into consideration the unique desires and needs of individual patients. In today's rapid update, we'll be going over key takeaways, so to get the full side-by-side, make sure to check it out on guidelinescentral.com. The guidelines from the AGA is a living guideline reviewed and updated every 6 months. The most current update focused on pharmacologic management of moderate to severe UC. 14 recommendations were made intended for patients with moderate to severe UC being managed as an outpatient. Advanced therapies for initiation and maintenance of remission, medications for patients naive to advanced therapies, and medications for patients who have been exposed to advanced therapies were discussed. This article only reviewed the recommendations for initiation and maintenance of remission. In contrast, the ACG guideline was more all-encompassing with 54 recommendations and 57 key concept statements. Recommendations for diagnosis, assessment, monitoring, prognosis, management of mild to moderate UC, management of moderate to severe UC, and management of hospitalized patients with acute severe UC were all included. This article covers the management of patients with moderate to severe UC. The ACG made recommendations for the use of oral budesonide and oral systemic corticosteroids for induction of remission, while the update from the AGA did not address these medications. Some areas that differed in these two guidelines include the following. Infliximab was suggested for combination use with an immunomodulator by the AGA, while the ACG also recommended combination therapy. They specifically recommended thiopurine be used with infliximab. The ACG and AGA recommended golimumab and adalimumab for induction and maintenance, but the AGA also suggested these be used in combination with an immunomodulator. Vedolizumab was recommended by both societies for induction and maintenance. The ACG adds that this drug is recommended over adalimumab. Filgotinib was not addressed by the ACG but was recommended for induction and maintenance by the AGA. These guidelines were otherwise in agreement with the exception of some differences in the strength of the recommendation. And there you have it. Make sure to check out the full guidelines side-by-side and other clinical tools at guidelinescentral.com.